Hi guys, good day or good evening wherever you are right now. My name is Aurora. You're here in my YouTube channel, Schwester Aurora. For those who haven't been here yet, I'm a registered nurse here in Germany, but I'm a Filipina from the Philippines, of course. So yeah, if you want to know more about nursing in Germany, and if you want to follow about how to become a nurse here, I hope you can follow my channel, and I hope that you can also hit the bell button if you want to be notified with my future videos. Okay, so yeah, today I'll just do this quickly and gonna go continue with the topic that I'm gonna talk about. It's about what is Ambulante Intensivpflege. And I know there's a lot of you, especially to those Filipino nurses who are planning to come here, and I do think that some of you have questions about this specialization here in Germany, because definitely we couldn't find this one back home in the Philippines. Okay, so I'm here to talk more about it, okay, or maybe an overview. So to start with, I'm a registered nurse here in Germany, working at Pegasus Heimbeatmungsdienst GmbH. That's where I work as an intensive care nurse, or Ambulante Intensivpflegedienst, or Krankenschwester, because I'm a female here. It's in the term for a registered nurse in German. Okay, so what is Ambulante Intensivpflege? So when you're in the Philippines or wherever you are in the world right now, I know we have different types of nursing. Okay, in Germany, in English, this term or terms is also called, or is equated with, outpatient intensive care, or it's also called like intensive home care, or some can also call it as like respiratory home care, or it's some sort of like outpatient, according to what I've learned from my Weiterbildung, okay, or the further studies when you come here. And then Ambulante Intensivpflege is needed because most patients here, they can only stay, or according to the doctor's orders, when they're in an intensive care unit, they can stay for a maximum of 3 months, I suppose, or as long as they're stable. However, these kind of patients need like a long-term intensive care. So it's actually like intensive care setup, but not in the hospital anymore, and they will be transferred to the house. So Ambulante Intensivpflege can be at home if the patient or the family of the patient wishes to do so, or it can also be in a facility, which is termed here in Germany as Wohngemeinschaft. So what we do here, okay, in Ambulante Intensivpflege, is that you have to be equipped with experience when it comes to emergency nurse or intensive care nurse. So most of my workmates who are working here in Germany right now, like scattered, north, south, and east-west, or east-west, whatever, you're facing to me or I'm facing to you, so wherever, everywhere in Germany, it's like needed, okay? So we have the mechanical ventilators, we have all the monitoring machines, but this is just an overview. But what I can give you is like, it's an intensive care setup, but not in the hospital anymore. They will be discharged or endorsed to the Ambulante Intensivpflege facilities, okay? I know in the States it's also like a different kind of facilities, or in Australia or in the UK, and I know that it's more of the continuity of care that we follow all, like everywhere in the world. So that's how it goes here. So what's the patient ratio it is, and what kind of nurses do Ambulante Intensivpflege companies need? So most companies need you to have like hospital experience or any clinical experience back home in the Philippines, or even without. However, you will be properly trained, especially when it comes to the notfall management or emergency case management, because sometimes you're the only one at home or in the facility, and that you have to do the emergency care, or the when you have to do the CPR, you know, on or before calling the 112, which is the 911 here in Germany. So, and we call the Rettungsdienst, is how you call it here, and you have to do like a specific flow first before really calling them, okay? But that's really how the overview. And the next one is about the patient ratio. We only have 1:1 patient ratio because it's in an intensive care, okay? So you have to really know, like, or you have to focus on one patient. This is for like some home care cases or home settings. But if you're in a Wohngemeinschaft or in a facility, intensive care facility, then it's either like a maximum of 2 patients per 1 nurse or 3 patients per 1 nurse. It depends, okay? I'm just talking in my experience and my friends here in Germany who also have the same work, okay? However, if you have any questions about this type of nursing here in Germany, you can comment down below, or you can follow my Facebook page. It's called Schwester Aurora as well, or you can follow the link which I will post down below. And I hope that you can follow in the next videos. I will post more about Ambulante Intensivpflege or any kinds of nursing or any information here in Germany that we can help, or that I can help to you, anyone in the Philippines right now, okay? So yeah, fellow Filipino nurses or any nurses around the world who are aspiring to come here in Germany and be a registered nurse, anytime just hit us up or hit me up on the comments or anyhow that you can, okay? So stay tuned and have a wonderful day, or have a wonderful evening, night, or wherever you are, and I hope you're having a good time, okay? Thank you, and till next time. I mean, not stay tuned, till next time. Bye! Oder auf Wiedersehen!